Today, I want to talk to you about loneliness. Do you ever have those days where you feel lonely in your work as a medical provider? Are there days where you feel all alone in what you do as a medical provider? Whether you're a physician, whether you're a nurse practitioner, or whether you're a physician assistant. And I'm not saying that we take our job for granted because we don't. We are all so hardworking and we find it so fulfilling to make it our calling to help people, to make people feel better. And, this is really hard work if you're in this area. We all know how difficult, how challenging this type of work is. And sometimes at the end of a really long day at work, and seeing dozens of patients and feeling all over the place from going to patient exam room and documentation up to our eyeballs. At the end of the day, are you filled with a sense of loneliness, a sense of emptiness, maybe even a little sense of misery? I have multiple days where I feel like patients just yell and complain to me. And, we don't have a magic pill that can miraculously cure their joint pain. Or, we have to do tests and exams and figure out what's going on first. We don't have a crystal magic ball in front of us. Or, patients get angry that as medical providers, we're running behind in our schedule. We're holding up their appointment time because we're seeing patients back to back, and the patient prior to them maybe needed a little more time regarding their health issues. There is so much unpredictability in healthcare and medicine, and that makes it really challenging. And sometimes there are days where I am so busy at my clinic. I am just so busy going from patient to patient to patient to patient that I don't even have time, or I barely have time to say hello and bond with my own fellow colleagues. Where sometimes we're like passing ships, like, hey, how's it going? Hey, how's your day? And we go on to see our next patient because we got to stay on that schedule because we got patients to see. And, there are some days where I am the last person in the clinic in the evening. Everyone else has gone home. I'm still working on my notes, my documentation, and it's quiet. It's dark out. In fact, I often, and maybe you relate to this, I often arrive to work when it's dark, and then I leave work in the evening when it's dark. It's like, did the sun even come out? Am I a vampire? And at the end of the night, I close up and I get in my car and I start heading home. And, do you ever have this single thought at the end of the day? Is this the life I dreamt of having? Is this all there is? It almost feels like a mediocre life. I don't even recognize who I am. I don't even recognize my life anymore. How did I get here? And, for a lot of us, we went into this career to help people, to make an impact on people because we want to help people, to make people feel better. We see the cause and um the meaning behind this work, the purpose behind this work. And sometimes it feels like I'm just surviving day to day, going through the motions. And if you can relate to this, I want to share a story with you. So I've been practicing as a nurse practitioner for quite a few years, for several years actually. And when I started out, it was very challenging. I mean, my clinic, my specialty, there was a rotating door of doctors coming and leaving, coming and leaving. And so for about several years, I was the only continuous provider there. And we'd have a doctor come in, a doctor get pregnant, a doctor leave, a doctor move, a doctor come and go again. In my first few years as a nurse practitioner in a specialty, I went through eight supervising doctors come and go, and I bridged all of their patient care. I covered all of their in baskets. And then I also covered 7 separate maternity leaves in my first few years. And so I saw majority of our patients in our specialty clinic. And it was to say it was challenging barely describes the picture, the feelings I felt. Every day I was miserable. Every day I wanted to quit. Every day I couldn't figure out, you know, is this what I wanted my life to be? How did I get into this position? And I couldn't quit because I had a six-figure student loan to pay back, right? A lot of us come out of training and we got like student loans up to like our ears. That's like more than a mortgage. It's ridiculous. And I couldn't quit. So I had to keep pushing through every day, through the grind, through the hustle, through the feeling that maybe I made a mistake, that my life is now forever messed up and I can never go back and undo it. And, as a human being, feeling lonely is not uncommon. As human beings, in fact, I bet you felt lonely in several seasons of your life. When I was in NP school, I felt so lonely. I felt so lonely. None of my original peers from college, from my, personal network, personal circle were going to NP school. None of them were applying, taking nursing prereqs, applying to NP school, getting through the studies and the curriculum, the rotations, and having this unpredictable schedule of rotations, day, night, 8 hours, 12 hours, this unit, that unit. Sometimes I drive 2 hours away to do a clinical rotation. And it felt so lonely being on that journey. I mean, I had classmates that were going through the same thing with me. So I made new friends and I made new, I connected with new people in my class, my cohort, but we were all doing our own thing. We were studying for our boards. We all had different rotations. We were all kind of on our own micro journey. And, every phase in our life requires a transformation of us. Every phase, every season of life requires a transformation within us. And it's supposed to feel hard. It's supposed to feel lonely. And you'll even feel some resistance to it. That's why no one likes change, because it's so darn hard. It is so hard to embrace change. And it requires you to elevate your identity. It requires you to attain new habits and even to embody new values. And so, when I began practicing, when I was in school, my values were to study books, memorize medications, learn about diseases, all these things. Learn the clinical skills I needed to understand the diseases, to pass my boards, and to be a licensed nurse practitioner. But when I began practicing medicine and working with real patients, it was an entirely new ballgame. I had patients yell and complain to me. They didn't feel cared for. There's people coming and going in our clinic. The care, it just seems so um, uh, just very choppy. Not There's no continuous care. There's no provider that's staying around. And the truth was, it left me feeling upset and frustrated because I'm trying to help these patients. I have memorized all these diseases, all these medications. I know how to treat their diseases, but the patients didn't feel like I was helping them. And so there was a misalignment. Maybe I gave someone a pill for their joint pain. But in doing so, I looked at their chart and I saw that they have no other major health problems. They have no kidney diseases, they have no heart issues, nothing that needs to be addressed when I give them this medication for their joint pain. And so, but the patient may not feel like that I was caring because I barely spent any face time with them. Maybe I that experience is very different from how the patient feels to how I thought I was providing it. Those are two very different things. And that's the part of medicine that we don't get in school and training. It takes so much more to care for people than memorizing diseases and memorizing medications and studying books and keeping our nose in books. And in this line of work where you work with people, actually any work where you work with people, I'm sorry, let me go back again. In our line of work, working in medicine, working in healthcare, and working with people, you have to realize it is a privilege to see people at their most vulnerable stage in their lives because it's regarding their health. When your health is in jeopardy, when you have a symptom, when you're in pain, it's scary. It's really scary. And it's the not knowing what's happening that's the most scary. You feel out of control. And it can make anyone get angry, get upset, get defensive. It can bring out a whole multitude of behaviors. And as healthcare providers, we often are in that line of fire, right? We're trapped in that line of fire. We're kind of the target for that patient's upset, frustration, impatience, those kind of things. So, why am I talking about all of this? I'm kind of going off a tangent, sorry. It can feel really lonely to practice medicine because we don't feel like we're connecting with people. And I know that sounds like an oxymoron because it's like, Nicole, we see people all day, every day. What are you talking about? Humans humans thrive on human connection. Human connection is what makes us feel fulfilled. We are social creatures by nature, and we crave and thrive on that social and connection with other people. But when practicing medicine, our work can feel very mechanical, very robotic, very on autopilot, very impersonal even sometimes. What disease does this patient have? What diagnosis is it? Okay, what are their symptoms? Let's prescribe this medication. All right, all done. Next. It can feel very robotic. And in this the whole systemic healthcare system, we're given a very specific amount of time to see patients. Maybe you're allotted 20 minutes to see a patient, maybe 15 minutes to see a patient. Maybe you're given teeny tiny 10-minute slots to see each patient. And that's why I created my challenge, the meaningfully connect with your patient in 60 seconds or less challenge. You know, we cannot change the system, at least not tomorrow. That's an uphill battle that we're all fighting to change the healthcare system. And for systemic problems in medicine, we are forced to see as many patients as possible in a single day, which means we may not get to spend as much time as we want in with each person as we would like to. But what that means is that as a medical provider, you need to be an expert in communicating and connecting with people. And so that's why I created my challenge is that it's a 5-day challenge. And it's designed to help you become that expert in communicating and in connecting with people because I can't give you more time in your visit. I would love to change the whole system, but unfortunately, that's an uphill battle that we're all fighting. But what we can do is improve our expertise and our skill in connecting and communicating with other people so that within seconds, you can connect with that person and make them feel seen and make them feel cared for. And so the link is below. I really highly recommend my challenge, the meaningfully connect with your patient in 60 seconds or less. You can connect with your patient in 60 seconds or less. I promise you. Practicing medicine is truly a journey. It's really a journey. It's not a destination where you finish your training, you're passing your boards and graduating, and now you are making the big money and don't have any worries at all. That's not true. You're not, you're learning now different skills. You're learning how to juggle patients. You're learning how to stay productive and meet quality metrics. You're learning to keep up with the documentation that are up to your ears and eyeballs. The things that you learn in school did not even come close to preparing you for practicing medicine, for the reality of practicing medicine. And so when you feel lonely in practicing medicine, in your work, when you leave the day and you feel a little bit of hollowness in your heart, a little loneliness, a little, this is all my life is, this is it simply means you're going through a new transformation. That's what it means. And that will require a different version of yourself with new skills. And so I hope this was helpful. I hope this brought a little bit of clarity to why if you feel lonely in your work, why that is. And I will see you all on the next episode. I love you all. Bye.